Hello, you are listening to The Local Lens, the podcast from the Powell County Health Department where we go inside our community's experience with the drug epidemic. And we're doing that by interviewing people who have these unique experiences on the addiction world and on recovery services. And hopefully, at the end of the day, after we see from enough different perspectives, we'll have a better view of addiction itself. Our show is coming to you from Stanton, Kentucky, a small town nestled at the foothills of Appalachia. And on this week's episode, we are doing part 2 of a 2-part series with Alex Elswick. So if you've not heard part 1 of Alex Elswick's episodes with us, then we encourage you to go do that. But if you're not able to do that, then we've included a small little highlight reel from that right here.
My name's Alex Elswick. I'm a person in long-term recovery from an addiction to Oxycontin and then to heroin.
But that was only a story for a little while. Since then, he's gone on to do quite a bit.
I went on and got a PhD and then co-founded a nonprofit called Voices of Hope. We're a recovery community organization, so we're not a treatment facility. We don't have beds. We don't have clinicians. All of our 30 staff are people in recovery, helping people in recovery. So that's very cool. And then currently I'm an assistant extension professor at the University of Kentucky for substance use prevention and recovery. So I write grants for prevention programs and do research on recovery and all these kinds of things.
What did life look like before addiction set in then?
Yeah, so I'm born and raised from Lexington, Kentucky, grew up in a really happy, healthy home. My dad's a doctor, my mom's an accountant. I grew up really, really privileged, grew up in the suburbs, went to private school, had everything I needed. But there's a lot of addiction in my family, in my extended family, so I probably inherited a genetic predisposition, and then a ton of anxiety disorders in my family. And I've been diagnosed with 3 different anxiety disorders, and I'm just an anxious person. It's just how I am. Yeah. And so I started, looking for ways to cope with how I was feeling, I guess, at 14 or 15, found alcohol, marijuana, loved it. But when I was 18 years old, I got prescribed oxycodone after having my wisdom teeth removed. And I took them as prescribed, but I got addicted to them, and that's really where my addiction started. So yeah, it was bad. And so no, I mean, I was 18 years old. I was in college. Center College is a pretty good school, pretty hard school, and I was making good grades and vying for a starting spot on the team. And in this perverse way, kind of in a shallow society like ours, it's really easy to look at that and go, well, this kid's doing fine. You know what I mean? Because those were my metrics for how my life was going. But the whole time I'm using more and more and more. Then the arrest happened, and it's just like the bottom fell out of my life in a lot of ways. I lost my friend circle. I lost baseball. I lost school. I lost it all at once, and then got this prescription. And it's hard to describe what it's like becoming addicted, but after just a few weeks of taking them, if I didn't take them, I felt sick. I felt, irritable, and just knew that if I could get more of the medication, I could be okay. I ended up getting kicked out of the house where I was staying with the girl I was dating, and went homeless. And so I ended up spending time homeless in Nashville, Tennessee, and Lexington, Kentucky, and then in Cincinnati and Dayton, and spent the very end of my addiction sleeping under a bridge in Dayton, holding a cardboard sign, and shooting dope. And I ended up spending 6 months at this shelter because I had nowhere else to go. And it was the worst, like the first month I spent there was the worst month of my whole life by far. But things started to change for me, and I woke up 3 months in feeling kind of human, and then 6 months in, and I was on my way,
So that is a ridiculously short summary of his story. He went on to get his PhD eventually, but this here is the lesson that we move forward with in this episode.
I would say my recovery is really intertwined with my privilege, however you choose to see that, with my wealth or access to resources or whatever, because so a lot of times after, like, I'll share my story somewhere, and people approach me afterwards, and they always say really nice things, and they're like, Alex, we're proud of you because you're strong and you're brave and resilient, and those are nice things to say, but that's not true. It's not true. And the reason it's not true is because if you believe that people recover because they're strong or resilient or because they work hard enough, then it means you believe that the people who are still suffering in addiction aren't strong, or they're not resilient, or they don't love their families enough, or whatever. It's just not true. Really, across the board, the difference we see between people who still struggle in their addiction and people who are recovering is access to resources, is getting the things that you need. So for me, my story has always been about the fact that I'm a person who got what he needed. And so I appreciate the kind words, and I know people mean well, but I don't deserve that praise. It's not the work that I put in. I haven't put in any more work than my best friend who's down at Fayette County Detention Center right now on cocaine charges. We're the same in terms of the effort, in terms of our desire to be well, in terms of our desire to be productive citizens. The difference is I had all this stuff that I needed and he didn't. And so really, when we started Voices of Hope, we started with that idea in mind, as we recognized I had this really privileged experience that allowed me to have success. And most people don't get to have that. So how can we replicate that experience for everybody in our community?
So that's what Voices of Hope is essentially all about. And it has been shaped by Elswick's personal experience.
I mean, as it stands now, you really do oftentimes either have to go to treatment or become incarcerated to access lots of resources. And that's pretty messed up, that you should have to catch a charge to get the things you need, when instead we could just provide the things they need first before they catch a charge, How about that?
All right, so now that you've got some background on who Alex Elswick is, we're ready to move into this new material. So we're going to be going over some of the things that he has seen as important and some of the things that he sees as the true roots of recovery. You're listening to The Local Lens. I'm your host, Nate Brooks. These are our people, using our voices, telling our stories, because no one sees it like we do. So I didn't start working in this field until the spring of 2020. And since then, I've noticed that there is quite a bit of funding coming from the federal government to address the opiate epidemic. And we've heard through previous episodes that healthcare providers are on board, politicians are on board, a lot of people are paying more attention to this. But still, we just heard Alex say that his privilege and his access to resources were probably the most helpful parts of his recovery.
Do you think that that privilege is meaning less now, just kind of in the way that like society is almost hopefully supporting it more, or do you think it's eroding at least?
No, I would say no and no, unfortunately. I would say no and no. Yeah, I think definitely it's become a little bit more of a politicized issue, so the federal government has taken interest, but we really don't support recovery meaningfully. What we mostly tend to support is treatment. Okay. So treatment centers get tons of funding. It used to be a problem 10 years ago trying to find a bed for someone. When if you have someone right there with you, they're willing to go to treatment. It was hard to find a place like that. Today, it's no problem. Our recovery coaches do it on a daily basis. We can get you in right away. The problem isn't the availability of treatment. The problem is the acceptability, which is to say, a lot of folks, the only treatment infrastructure we have is based on abstinence. Your goal for your recovery has to be you're never going to use another drug again. And that just doesn't suit a lot of people. And so there are a ton of people who will never go to treatment because that's not their goal. Their goal might be to improve their health or to get a job or whatever it is. But their goal is not to stop using everything. And so much of the funding goes to treatment centers that we have plenty of treatment available, but as I even told you in my own story, treatment isn't a cure-all, right? Just because you're 30 days sober out of a treatment center, you've still got a whole life you got to live when you get out. And that's where the resources are desperately needed. That's where privilege and access makes such a difference, and that's where the playing field is so disparate right now.
So if somebody asks you, if Mr. Biden calls you right now and it says, "Hey Alex, I've got some money, how do you want to spend this money to help?" What do you do with that?
Community-based resources. So instead of putting all the funding into treatment centers where we've got to take someone out of their community, away from their family, they got to quit their job, they got to find someone to watch their dog, and they got to go spend 30 days in a treatment center. It's taking all of the factors, the ingredients that make treatment so effective. So like, why does treatment work? Well, it works because you have these educated counselors. They have constant access to peer support. They go to meetings. They have nutritious meals. They have structure. All these things that are features of treatment that make it effective. How do we transplant that into the community where people live? Because that's where they're going to have to be in recovery for years to come. So how do we make sure that there's ample peer support and ample access to educated counselors and all those things? So that's really what we're about at Voices, is really that piece. Working with people who either don't ever go to treatment, which as it turns out is most people in addiction won't ever go to treatment. Working with people who have gone to treatment and now they've gotten out and need some aftercare support. And really just working with a lot of the folks who are overlooked by the traditional kind of treatment infrastructure.
And this is one area where Voices of Hope is really effective at what they do, because they don't just sit back and wait on people to walk through their doors. They go out and try to meet the people that they know need help, and they make their help available to people. They go out of their way to put themselves in front of people.
On one hand, you could say, well, look, there are these resources available in town that the government or whoever has helped to make available. So that means everyone has access. But do you have a car? Do you have? Do you know how to use the bus line? Do you have? Are these things that are in predominantly white communities? So maybe if I'm a person of color, I'm not as interested in going in that space. So there are any number of reasons why, even though it may be available, it might not be accessible or acceptable. And so that's where having a mobile unit, where you're literally and figuratively meeting people where they are, like we go to them, right? We spend a lot of time, for instance, at the plasma center, because people who use drugs oftentimes will donate plasma as a way to make cash. And so it's really about going to where these folks are to meet them, to say, you don't have to come to us to get the resources. We're going to come to you to try to level the playing field.
Yeah.
So I am from Stanton, Kentucky, and this show is mainly designed to serve Eastern Kentucky, and there's not much racial diversity there.
What can you say on just being in a city setting where it affects people from all kinds of walks of life? It's not just Eastern Kentucky that's getting hit by this. Do you have any thoughts on that at all?
Yeah, I mean, rates of addiction are stable, really stable across most demographics, especially across race. And so that's we know that rates of substance use are stable across race, but when we look at the numbers of the folks that we were serving at Voices of Hope, we noticed we were serving predominantly white people. And so what we know is that there are people of color in our community who really could benefit from our services. In fact, the most recent set of data shows that the largest increase in overdose mortality was among Black Americans.
Okay.
Right? So it is a community that's being hit hard, even though we have tended to talk about the opioid epidemic as a white problem. It's not. So yeah, that's another example of why we're trying to take proactive approaches to say, who are the folks in our community who need help the most? We need to go there first.
So the main reason why I wanted to bring this up is to show that this affects more people than just Eastern Kentuckians. People tend to focus on the problems that they see right in front of them, the ones that affect them directly. So you have to keep in mind that this problem extends way beyond the borders of Eastern Kentucky. It extends way outside of Powell County. It affects people all across the country. So we are really not alone at all in this fight. There are so many people across the country and around the world that have these same struggles as us. All right, but let's get back into the interview.
All right, so you started alluding to community-based care as well. A part of that is families, and that's where your training is in.
Yes.
So let's dive into that. How important, so what do you do for families, I guess, specifically?
Yeah, so working with families is really an important part of putting in place a support system for someone who's in recovery. And when we say that, I think people's minds first go to teaching family members how to be supportive. And certainly that's part of it. But it's also about helping family members see the ways that, and this sounds harsh, but it's very true, the ways that they may be unintentionally contributing to the problem. So what happens most often is families say, well, my son's the one addicted, so he's the one with the problem, and he needs to go figure it out. And what we know is if that person lives with his family, he's embedded in this family system, then he's impacted by all those folks around him. So as a family therapist, what we would try to do is get every member of that family in the room. The sister, mom, dad, everybody who's willing to come. And instead of saying, hey, your son has a problem, it's like, hey, this family has a problem. Right? Because one of its members is having a problem. So how do we get everybody on the same page to work against the problem together? How do we unify a little bit? So that's generally where I would start, is just making sure we're all working together against the problem. And then it's sometimes it's about helping family members. I'll tell you, for me, my parents were a tremendous source of support for me in a lot of ways. But also their anxieties, their fears, when I would get out of treatment, would get projected all onto me. Okay. And so not only am I dealing with early recovery, the stress, the anxiety of my own stuff, of trying to get a job and deal with my criminal record and go back into school and all these things, but now I'm also dealing with the pressure of their fear about my relapse or whatever it is. And so a helpful part of our family therapy was a therapist helping all of us take some ownership in saying we all contribute in a way, even however small. And so I'm really grateful. I had parents who were humble enough to participate in that process, and it was just immensely helpful.
So this makes me think of some of the past episodes we've done, like Krista Newton, who said that her family was absolutely enabling her addiction, but she ended up recovering eventually. And then on the other side of the coin, you have people like Paula Adams, who was trying her best to support her son, and they didn't know what the right thing to be doing was. And they tragically ended up losing their son. But there are all these different sides of this. People all have different experiences with this.
It's a big world where some things work in some places and some things don't work in other places.
That's really well said. So there's a really fine line between enabling and supporting someone.
Okay.
Right? And it's we have done a tragically poor job of helping family members understand that there's a difference, because we talk about enabling so much, it's a buzzword, family members get afraid to enable. What we're trying to keep you from doing is enabling their addiction. But if what you're enabling is their recovery, that's a good thing, right? That's something we want you to do. And so I think if we just say enable, we scare family members away from supporting their loved ones. And my parents talk about this, that in the beginning, when I needed help with finding a job and getting transportation and some of these things, they were afraid to help at all because they thought that what they would be doing is enabling. And so then what you have is someone who's struggling to re-enter society who's not getting any support, because we're all saying, well, we don't want to enable. So it gets really complicated. And I love the way you said that essentially what works for some people in this circumstance might not work in another. And so when I train family members, that's often what I tell them is, I can't give you a perfect rule of thumb for what enabling versus supporting is, because what's enabling in one context might be supporting in another. But ultimately it's about, are you making it easier for them to continue to live their life in addiction, or are you making it easier for them to pursue a life in recovery? That's kind of the basic.
Like, some people will preach that like the only way you're going to make it through recovery and stay in recovery is to go somewhere else. Yes. But then some people are staying in their communities. And so that's kind of an interesting, I guess, debate, if you want to say. So sometimes people, particularly in 12-step communities, will talk about the geographic cure, which is, hey, I've got an addiction, I'm around all these people I'm using drugs with, I'm going to try to move to a different city to try to change my circumstance, and that'll change my addiction. And generally, when we're talking about it, it's being talked about negatively. People are saying that the geographic cure doesn't work. And the phrase is, wherever I go, there I am. I take myself with me, right? So if I'm addicted in Lexington, I'll be addicted wherever I go. There's some truth to that, but there's also some truth to, on a case-by-case basis, certainly changing your circumstance could be a critical factor in your recovery. I mean, if you're living in an abusive home or an abusive relationship or in a place that's just not conducive to your recovery, certainly moving to a different condition can be helpful. So I think it's a case-by-case basis and what's really working for that individual. But for me, I can tell you it was a big advantage to do a little bit of both. It was helpful to be early in recovery out of town because I didn't know anybody. It's a lot harder to it just puts an extra step between you and using a drug. But then I came back to Lexington, and I think it was helpful because this is my community, these are the people that I care about and people who care about me, and it's in this community where I've gotten so many opportunities, and I just can't imagine that I would have had these opportunities had I tried to start over somewhere fresh.
So far we've looked at how important the community part of this is, how important your family's involvement is, but there's another big piece, and that's the medical side, the healthcare side. And I always kind of hate getting into medical stuff on this because it's so complicated, and like the healthcare world is so complicated, but it really is such an important piece of recovery. So let's take a step back and look at all of healthcare in the United States. We spend more money on healthcare than any other country in the world, but yet we have worse results than pretty much all of the other countries that we like to compare ourselves to. And this is talking about all medical things like heart disease, strokes, cancer, all that kind of stuff, everything. And there's a really long list of reasons why this might be, but one of them that's definitely on the list is we don't practice preventative care much. It feels like our healthcare approach is to put Band-Aids on things, not to prevent things from happening.
No, it's exactly true. And it's especially true for addiction because where we haven't known what addiction is, like is it a disease, is it a disorder, is it a choice, we haven't known who should be responsible for addressing it. So is this a problem for psychiatrists or psychologists? Is it a problem for public health folks or for medical professionals? Is it, in the prison, wherever? And so because nobody owned it, addiction everybody passes the buck. The buck doesn't stop with anybody. So lots of groups will chime in and do good work, but at the end of the day, it's like, who's accountable for the fact that we have no public health infrastructure at all in this country, right? Like, who's responsible for that?
Yes.
Yeah, and so all the time when people ask about causes of the opioid epidemic, there's a long list that you hear talked about all the time that we could have gone through about Purdue Pharma pushing OxyContin and about pain as a fifth vital sign, all these things. But the one that I think everybody misses is even prior to the opioid epidemic, we had a really poor infrastructure, and we're always behind the eight ball when it comes to addiction. So we were just vulnerable from the start, I think.
Yeah. It kind of seems like it was just the plague that we were bound to face.
We were just waiting for it.
Yeah.
And we've all heard the saying that history repeats itself, and that makes you think of when Britain and China, they fought the Opium Wars. They did 2 different wars over this stuff, and it was because the British people were like, these opiates are really ruining our society. They're messing us up. So the dangers of this stuff isn't new to our generation. It's been around before, and it's in history.
I guess another thing that I learned that I didn't realize is prior to 1914, drugs were just legal in the United States. And you would literally go down to your corner store, your Walgreens or whatever, and housewives could get these patent medicines that had heroin in it or laudanum or cocaine or whatever. And we didn't have a widespread opioid epidemic. We didn't have all these problems. And people had steady access to these drugs that we think are so highly addictive. So
the main point of this is to know that drugs are not new. We're not going to completely wipe drug usage off the face of our planet. So what we need to pivot and do is just keep our people safe and alive.
We're constantly told stories about addiction that simply aren't true. And unfortunately, sometimes we're told those stories by the people who should know. And it has real consequences for people who use drugs. So at the end of the day, a lot of my personal mission is trying to use my experience to show people when we meet people's needs, they get better. So we have to, addiction's complicated, but we don't have to act like we have to find some elaborate solution. At the end of the day, when you treat people with dignity and respect, and you give them the things that they need, they get better. That's just been my simple experience across the board. But when we get too obsessed with whether or not they can pass a drug test or whatever, we're missing the boat a little bit.
Yeah, that makes sense. That makes so much sense. So actually, there was one question from earlier that I wanted to address, and then what you've just said brought up this one. So remind me to go back to the one from earlier.
Got it.
But, so you've mentioned a lot of like hinting at being functional just in society.
Right.
So, but then you also mentioned like natural recovery. How do you feel about medical assisted treatment? What do you see as the role for that?
Yeah, so I'm a big believer. One of our core values actually that we post on the wall here at Voices is that we value all pathways to recovery.
Okay.
And a lot of people will say that, but it's another thing to practice that, to really practice what you preach. And we really are intentional about dignifying all pathways. And so that means whether you use drugs, if you drink alcohol or use marijuana or whatever as a part of your recovery, that's okay with us. We're not here to tell you what your recovery looks like. Let me back up. The definition of recovery, if you actually look at the definition, SAMHSA's working definition right now is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. It's the full definition. No mention of drugs, no mention of abstinence, because that's not the goal, right? We're not about reducing drug use, we're about reducing the harm of drug use. I truly, genuinely don't care what you put in your body. I care what you put in your body if it raises my taxes or if it whatever, right? We want to address that. So yeah, will you remind me the original question?
Medical assisted treatment.
Yes,
but
yes.
I mean, you were hitting at
Yes,
it.
I was getting there. So yeah, we respect all pathways, and the evidence on medication is actually really, 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 really strong. Really strong. And it's really hard to be a scientist. So my training is about how do I look at research, tell if it's good research, tell what it means. That's what my job is. I spent years training for this. And to see that there's such strong evidence for medication and there's so much stigma around it and so much conversation, like people are just substituting one addiction for another or whatever it is. I can tell you this, we're in the midst of an opioid overdose epidemic, losing people on a daily basis. There is only one treatment of all the treatments available. There's only one that effectively reduces your risk of dying, and that's medication, right? At a time when people are dying in droves, that sounds like a pretty important medication, right? Yeah. I'm not saying everybody should be on it. I'm saying it needs to be available to everyone. And so like people ask me about my experience with medication. The stigma was even worse 10 years ago, to the point where it really wasn't even offered to me as a legitimate option. So the first time it was presented to me, it was talked about by a healthcare provider as if it were like an alternative therapy.
Yeah,
like
they're go to Mexico and get this.
Exactly. So he's like, well, you can do inpatient or outpatient, and then you could do this medication. And I thought, like, is it like acupuncture? Like, what are we, it's some strange. And then imagine my surprise when I find out that that's actually the gold standard for treating the problem that I have. And nobody even presented as an option, right? Really bananas. So yeah, we definitely support medication. I think the stigma against medication is born of the same problem I've been talking about, which is our obsession with abstinence. Because we assume that because you're taking something, your recovery is not as solid or as strong as somebody who's abstinent. And I am telling you that that's so far from the truth. So far from the truth. You can be stone cold sober and be an asshole. And you can be stone cold sober and do harm and be lazy and all those things. Sobriety is not a virtue. So definitely a strong supporter of access to medication. I mean, we support everybody choosing what their recovery looks like for themselves, but everybody should have access.
So we're right here at the end, and I really have one more question for Elswick. Seeing that he has so much lived experience through this, and then even further, his job as a professor now is to keep learning about addiction. So I asked him if he had any words to share with the world from what he's learned and experienced. What would it be?
I guess my parting shot would just be really about open-mindedness. That one of the things I learned that was like groundbreaking for me, to realize that people could recover without treatment and without help. And before learning that, I was totally closed off to that possibility. So I guess I would just finish by saying, you don't know what you don't know. And so stay open-minded. I meet a lot of folks who have 30 years experience in the field, but they have 30 years experience doing one thing in a treatment setting. And so they have 30 years experience with abstinence, and they haven't seen what I've seen. And so just begging people, keep an open mind and be open to the fact that you might learn new things about addiction.
Well, that brings us to the end of our two-part series with Dr. Alex Elswick. I would like to thank him so much for coming on our show and sharing his story and a lot of what he's learned with us. We really appreciate it. I'm thinking back to the time when we actually recorded the episode, how much of my own view he changed through learning about this stuff. There are a lot of people out there talking about what is good to do and what is bad to do. So with that many voices, it can be hard to know which voices you should trust. And I happen to find his one of the most trustworthy voices, because not only did he live through addiction, he also went out and got a job that was essentially to keep learning about it. And now through his nonprofit, he helps spread what he's learned and helps pull a lot of other people through recovery with him. Anyways, that is all the time that we have today. Thank you so much, Alex, for being on the show. Also, big thanks to WSKV for broadcasting our show, and then Kentucky Rio and the health department as well for letting the show be a thing. This is The Local Lens. I'm your host, Nate Brooks. These are our people, using our voices, telling our stories, because no one sees it like we do.